Well, New York seeing the early signs of another COVID spike. This is due to the newest COVID variant, BA2. And the city wants to prevent that spike and long lines for COVID tests like we saw last December. So New York City Health and hospitals once again distributing home testing kits.
Joining us right now, the executive director of New York City Health and Hospitals Test and Trace Corp., Dr. Ted Long. Doc, nice to have you back on Good Day New York.
Thank you for having me.
So you're not tracing anymore, right? Because we're hearing people getting sick, they're taking home tests. You guys have no idea how many people those are because they're home.
Yeah, right now we're in a new phase of the pandemic, and the most important thing for you to remember is that we're prepared. We know cases are going to go up, and what we need to do to get our city ready is we need to pre-position everybody that is willing to have a home test in their home before they get sick, so that you can use that test before you go to work or before you see loved ones. And if it's positive, I'll tell you how I can connect you to treatment.
Okay, so I heard that you guys have a bunch of tests just sitting around that you want to give out. So how can we get our hands on them?
Well, thank you for asking. So we have 6 million tests we're going to be distributing through thousands of locations across New York City. Again, like I said, at this point in the pandemic, we're learning to live with COVID. We're going to safely get through the BA2 variant by using things like our home tests and like our new treatments, which we never had before. To find a home test near you, which are always free if it comes from me, call 311 or go to NYC.gov/COVIDTest. And we're going to have them at libraries, cultural institutions, community-based organizations, houses of worship, even at our testing sites. There's no wrong door for getting a free home test.
I do want to ask, because are you expecting to see those long lines for, getting tested that we saw back right before New Year's, before Christmas?
Yeah, it's a good question. So your city-run sites, we tripled the number of sites that we had prior to Omicron to the first week of January. So we massively grew out our infrastructure in New York City. We can reactivate that infrastructure as we need to. I hope we don't need to, though, because the best thing that we can do is to give you the ability to test yourself the minute you develop symptoms at home. And if you have a positive result, call 212-COVID-19, press 9. In a matter of minutes, you'll be on the phone with a doctor. And if you're eligible for one of the life-saving medications, we'll get it to you in your home that same day.
Now, when we kind of look at a lot of people getting COVID, especially now, most of them being vaccinated here in New York, it is pretty mild, is what we've seen. So what is the point of maybe just staying home and just waiting till it kind of passes, or instead of trying to go out and get a COVID test? Because, when we saw the past couple months, you had so many people lined up leaving their homes, so maybe they should have just stayed home.
Yeah, good question. So in terms of learning to live with COVID, what we want to do is for you at home to not have to go out and get tested. We want you to have a home test already in your home. So don't wait. Go today. So if you wake up in the morning, you're about to go to work, you aren't feeling 100%, do that home test. And in a matter of minutes, you'll know if you have COVID before you've even left your home. And if you're eligible, again, as a primary care doctor, I have to really emphasize this point. These treatments will save your life. Every 20 patients of my own that I treat with Paxlovid or our monoclonal antibody, I prevent one of my patients from getting so sick that they have to be admitted to the hospital. This is a new phase. We're going to get through this wave, learning to live with COVID through testing ourselves early and often and getting treated with these life-saving treatments that we never had before. And that's what it's going to be like.
So we're hearing about this BA2 going around. How serious is it? Are people winding up in the hospital?
So right now, our hospitalizations are very, very low. Our goal is to keep it that way. And the best way to do that, again, is to break chains of transmission by knowing if you have COVID. So pick up your home test today. And again, tell friends and family members and loved ones, especially those that are older. If you have COVID, it's no longer a scenario where there's nothing we can do. There's so much we can do, but you have to help us to do it. You have to tell everybody to call 212-COVID-19, press that number 9, talk to a doctor, and let us send you a medication that can save your life.
Okay, that's good to know. Now, in Europe, we're hearing about COVID cases spiking, especially in the UK and China. But the UK, meanwhile, disbanded basically a unit that you run right now in New York City. They're not keeping an eye on anything. They're like, we're learning to live with this. It's like the flu.
Yeah, in the UK, they removed all of their restrictions almost simultaneously at the same time. Here in New York City, New Yorkers have always stepped up. So when I say come and get a free home test, New Yorkers you're going to come and get one of those free home tests. And I think what's going to keep our city safe and open throughout is knowing that for New York City, learning to live with COVID is when you wake up in the morning, if you aren't feeling well, you can know if you have COVID. And then there's a number you can call. You can have the medication delivered to you in your home that same day. If we do those things, we're going to save lives, break chains of transmission, not have people with COVID going to work if they should be staying at home. And that's going to keep our city safe and always open.
All right. Well, we appreciate you coming on and spreading the good word. We will get through this, Doctor.
We will, safely, and our city will remain open.
Okay. New York City Health and Hospitals Test and Trace Corp. Executive Director, Dr. Ted Long.
Thanks for having me.